This week on Malaria Watch TV, Policy Center intern Nafisa Jiddawi interviews her father, the Minister of Health for Zanzibar.
So this is Dr. Jiddawi. He is the Principal Secretary of the Ministry of Health in Zanzibar, Tanzania. And I'm going to ask him a few questions regarding the malaria situation in Zanzibar since they've had great success there. Can you please describe the current malaria situation in Zanzibar compared to the past?
Yes. Currently, malaria, I have to begin by saying that malaria is very rare now in Zanzibar. I don't say that it is completely eliminated, but it is very rare compared to 4 or 5 years ago when we had a prevalence rate of around 40%. That means 40% of all Zanzibaris were infected with malaria. But now our prevalence rate has been less than 1%, and this has been shown in RBM indicators as well as in the Tanzania Health Indicator Survey, which was done about a year ago, and also in our own Ministry of Health surveys, in different cross-sectional surveys. So I can confidently say that malaria is very rare in Zanzibar, has been dramatically reduced in a short span of time.
What factors do you think contributed to that success?
Well, that's a good question. I'm sure that the different interventions, like endoresidual spraying, where I'm sure we're in our 5th round. 2, utilization of nets. You see, we have surpassed our budget targets, and in a lot of our people now sleep 80% coverage of long-lasting nets. And 3, of course, is the artemisinin-based combination using artemether and other amodiaquine or lumefantrine, which treats and reduces transmission as well. So these are the major interventions that were used, and together they had an effect of bringing down the prevalence of malaria in Zanzibar.
What do you think we could do to assure that that malaria does not resurge?
Yeah. Well, the situation now, the prevalence is very low, but we have to keep our guard and make sure that it doesn't resurge, because if it resurges, then it will resurge with a vengeance. Children born now have no immunity towards it, not like us when we grew up with it and we have developed some kind of immunity. So we have to work hard and make sure that it doesn't resurge. And to do this, 1, we've got to have a very strong health system. 2, we have to set up a surveillance. We have to have very good surveillance. And we do this now, I don't know if you're aware or not, using mobile phones, the Malaria Early Epidemic Detection System, which uses mobile phones to report cases of malaria to the Zanzibar Malaria Control Programs and to other officials as well. This is done, it's computerized, and it was designed by Cellcom. So we now know, we started with 10 sites, but now I think we have 69 sites where mobile phones are being used to report cases of malaria. So we have to detect the malaria early, and then we have to be able to respond in case there is an outbreak in some areas. We have to have response teams who would go around to check the slides, to see if people are maybe they're not using mosquito nets, to spray if necessary, you see. So the word here is surveillance and a good response, you see, as one of the interventions to try and make sure that the malaria doesn't resurge. Another thing is to BCC, behavioral change and communication. We have to keep on campaigning. We have to tell the people that malaria is low, but it doesn't mean that the potential of it springing back is gone. It is there, and it will be there for a long time. We don't have to think of ourselves now, but we have to think of the future generations, you see. And I'm sure that malaria have had a lot of economic impacts in that productivity fell down, understanding of the children at school was down. And once malaria is eliminated, even the economic dividends will be seen by our future generations, in the sense that they will learn better at school, absenteeism will be less at school, and absenteeism will be less, they will learn better, and absenteeism at work and productivity in the final analysis will definitely go, and therefore our economy will definitely increase. So the investments that the PMI and other donors are doing, I'm sure in Zanzibar will pay dividends in the short and we are already seeing the dividends now, and we'll see more in the future.